Hey guys, so this is Group 22 and our quality improvement project is about improving treatment documentation. So just a little background information. A study at St. Mary's Duluth Clinic in Minnesota found that paper documentation had many negative effects. It decreased inter-provider communication, did not meet Medicare documentation standards, and increased inefficiency and waste. So the impact on healthcare delivery is that it decreases patient satisfaction with care due to decreased perception of inter-provider communication, fewer patient contact hours due to not charting at the bedside and paper charting consuming more time than the EHR does, and decreased Medicare reimbursements to the hospitals who did not meet documentation standards, resulting in the inability to reinvest into facilities and staff development. So to approach the problem at hand, SMDC did several things. They converted all of their sites to Epic charting. They used a template in the EHR to improve Medicare compliance and did extensive staff training on Epic. And the results were that over $15,000 in annual savings occurred. There was reallocation of FTEs from secretary to other duties. There was improved compliance with Medicare standards. There was an elimination of concerns regarding the legibility of handwritten documentations, and there was an increased inter-provider communication. So the lean tools that we implemented in our video were the TACTime, Poke Yoke, and the 5S. So the TACTime reduces waste by eliminating time that different members of the care team spend waiting on each other. Multiple people can access the chart at the same time in Epic rather than waiting for one person, such as the nurse, to finish using the paper chart so that the doctor can look at the chart. The Poke Yoke is an example of error-proof charting that is used when administering double-check meds, like insulin. A reminder pops up in the EHR to have another nurse co-sign, and the med administration cannot be updated in the MAR until another nurse uses her username and secure password to sign off on the use of that double-check med. And with the 5S, care is more organized through standardization of charting. Epic uses tabs with the same boxes to be filled in for all assessments, notes, care plans, etc., to ensure that the same documentation is being done for all patients rather than paper charting, which risks documentation being incomplete or inaccurate due to disorganization. With the current value stream map, a nurse receives a patient, assesses the patient, receives orders from the doctor, assesses other patients. Inaccurate charting of assessment later in the shift occurs because she's forgotten what she assessed. There's no inter-provider communication. Patient does not receive quality care. The patient is then discharged without referral to a specialist. The patient then has to return to the hospital because they didn't receive adequate care. And the patient has poor documentation in the health record from the previous stay. And then the patient ends up dying or has a poor outcome because of ineffective charting. The waste with this value stream map occurs because the patient has to return to the hospital, which in turn is costing the hospital more money, and inappropriate documentation of advanced directives, living wills, and code statuses causes inappropriate interventions to occur, and the hospital stay is not covered by Medicare. So with our future value stream map, the nurse receives a patient, assesses a patient, receives doctor's orders. She initiates orders in quality patient care. A continuous assessment and charting is occurring simultaneously. She's charting at the bedside. Inter-provider communication via the EHR occurs. Patient receives quality assessment and implementation of interventions. And based on the doctor's orders, referrals are given to the interdisciplinary team. The nurse goes back and reassesses the patient, charts at the bedside, sends patients charts to referrals via EHR. Then the referrals received patient information for follow-up care, and improved quality of care and easier access to care health history in the future occurs. So here's a review of our literature. In the following videos, we analyze the problem at hand.
Hi, my name's Carolyn. I'm going to be your nurse today. How's it going?
Okay, I guess I haven't really been seen.
Okay, great. Yeah, you just transferred here, right? So I've got to wait on all the information. So I want to do like an assessment, make sure you're okay and all that good stuff.
Okay.
I'm going to go ahead and listen to your heart. Yeah, that's a good heart rate. Okay, yep. All right. Everything's looking good. I'm gonna check your nose out and your ears. You look really healthy. You've got some medication running.
What is that?
Yeah, I'm not really sure because you transferred, so I'll find out for you, but I don't really know. I gotta figure out who your doctor is first, and then figure out what medication you're on. But I do know I have to give you this insulin shot. Oh shoot, I forgot to double check this with another nurse.
Oh, you want to go do that?
No, it's fine. I'll do it later. I'll just mark it down. I'll just remember to do it. Yeah. Here. And I'm gonna put it right here.
I've never had it there
It's
before.
okay. It just goes to your heart faster. See, it's all done. All right. Good stuff. Yeah. So you're looking pretty good.
Well, do you know when I'm going to be getting out of here? Because I have a job I got to get back to and,
Actually, no, I don't know when you are getting out of here because, I got to figure out who your doctor is. But I haven't gotten any charts from where you came from, and the doctor doesn't have any charts, so we got to, once you figure out your doctor, they should come in and see you, though. So,
okay.
Yeah.
Well, can you make that happen?
Yeah. I'm gonna go do that now after I go see all my other patients.
Okay.
Yep.
2,000 years later.
Jeez, okay, I just saw like 1,500 patients. Now I have to chart on all these. Oh, I'm so exhausted. Shoot, okay, I don't even remember whose patient this is or their I think her heart rate was 20. No, that was her respirations. Was that? No, her heart rate was 20 and her respirations like 55 or something. Yeah. Neuro, she was not, like, I don't know. I think she was with it. I'll say with it. GI, who knows? Skin, she had no wounds. Oh, she did have like a small cut on her arm. Small arm wound.
Hey, can I see,
Hi, Dr.
patient
Urkel.
Hi, how are you?
Yeah, I'm actually still trying to chart because I just saw a bunch of my other patients. I'm trying to remember what
The
to put
Sally's
down.
chart?
Yeah, this is her chart.
Her heart rate was 20?
No,
think she would be-
that
think
might
she
have
would
been
be
her respirations. I'm just like remembered wrong. It's hard to go back from each patient and come back and chart.
Well, I can't do my job if you do your job right. Let's go in that patient's room. I can't do my job if you don't do your job.
Okay, well I'm trying my best.
Go check if she's alive.
Hey, it's Carolyn again. I'm back to do an assessment on you. The doctor was very unsatisfied with my my assessment. Oh my gosh. Oh my gosh. Code!
Wait, do you know her code status?
No, I never got to read the paper chart from her transfer.
I think she's a DNR.
Well, I don't know. We don't
I think
know.
she's a DNR.
We don't know if she's a DNR.
Where did that
or
wood
not.
come from? She sent it. I'm her daughter. She's a DNR.
Oh no. I just tried to resuscitate her.
No. I'm so sorry.
No. But-
I'm crying.
Hey, doctor, you need to call time of death. I think she didn't make
Get
it.
the mom out of here. I'm her daughter. Time of death is 1435.
Oh, look, a letter from Medicare. Medicare will not be reimbursing this hospital due to a lack of meeting Medicare documentation standards.
So how did things go so wrong? Obviously, the nurse did not chart her assessment findings immediately, resulting in inaccurate documentation. She provided care without access to the patient's chart, administered insulin without verifying or co-signing with another nurse. She wasn't able to answer the patient's questions clearly. The doctor was unable to provide care due to lack of nursing documentation. And then the patient dies because charting was not clear. The charts did not meet Medicare standards, and the hospital was never reimbursed.
Hi.
Hi, Sally. My name's Nurse Emily. I'm gonna be your nurse tonight.
Okay.
Okay. I just got a report, and I'm gonna do a head-to-toe assessment really quick.
Okay.
Listen to your heart first. And now I'm gonna listen to your belly. And I'm gonna feel your pulses. Okay, sounding good. I'm gonna chart really quick before I forget.
Okay.
So your heart, I heard your S1 and S2. Your bowel sounds were present in all 4 quadrants. Your pulses were 2+ bilaterally. Okay, and now I'm gonna just look at your wound. Oh wow, that hasn't been changed in a while. You have some serous sanguineous drainage and well-defined borders. I'm gonna get that changed, but I'm gonna chart first.
Okay.
So, okay. Okay, and then I saw your sugar was high, so we're gonna give you some insulin, but I'm gonna have a nurse to co-sign first.
Okay.
Hi, I'm here to co-sign your insulin.
Hi.
So we're giving her 5 units of normal insulin.
All right, looks good. I love how these EHRs are so error-proof, don't you?
Yes, I love that.
Right.
I love how you're in the room too. I feel like I'm spending a lot of quality time with my nurse.
That's great. Good to
Good.
hear. Do you need anything else before I go?
No.
Okay.
Good. Thank you.
Okay, so I'm just gonna give this in your belly. Oh gosh. So it's absorbed quicker. Okay. Okay, do you need anything else before I leave?
I was wondering about my diet order. They said they would put one in for me. Can you check?
Yeah, so Dr. Arkel put in a diet order for a healthy heart diet.
Okay.
And
That's
I'm
really
gonna-
that's awesome that you can see that
Okay, good.
on there.
Okay, good. Yeah. Good.
Hey Nurse Emily, how are you doing today?
Hi, Dr. Arkel. I'm doing great.
I saw all the charting you just did. It allowed me to update my plan of care really fast. Everything went so smoothly. Thank you for all your detailed
No
work.
problem. It's
This
so
EH
easy with this EHR.
Is it?
Yeah.
Well, I brought you a pumpkin spice latte with 2 extra shots of espresso for your hard work.
Thank you.
You're
That's
welcome.
So nice.
Sally, how are you?
Good. How are you, Urkel?
Pretty good. I just want to know that you're gonna be discharged.
Oh, good.
Yep. So pretty much everything's gone smoothly. You've healed very quickly due to every detailed nursing charting that has been done, which led to a lot of like interventions that things that were caught quickly. So you have healed pretty well. We're impressed by your healing time.
Yeah.
So if you have any more questions, then you can probably you're free to leave now.
No, I would just like to say that I really enjoyed the nurse being in here, explaining everything and charting and telling me what was going on and everything. Got to spend a lot of quality time with her. So it's
Sounds good. I'll let her know about that. Okay.
Okay, yeah.
Do you want to sign these discharge
Yeah.
papers for me? Thank you so much. It has been a pleasure.
Okay, yes.
Bye-bye.
Thank you. Have a good day.
Thank you.
Oh, look, a letter from Medicare. Says Medicare will be reimbursing this hospital $100,000 for meeting all of Medicare's documentation requirements. Great job! Yay!
So how did things go so right in the previous video? The nurse charts her assessment at the bedside using organized charting in the EHR, resulting in accurate documentation. She adhered to policy of having another nurse co-assign in the EHR for double-check medications, answered patient questions by directly referencing the EHR, which therefore improves patient satisfaction. The doctor had immediate access to the chart, which improved timeliness of care and discharge of the patient, and the charts met Medicare standards, resulting in hospital reimbursement. Our clinical expert was Barbara Tharp, charge nurse at 6 Park Tower at Baptist Health, who's had 30-plus years of nursing experience and is an EPIC educator. We asked her, in her experience, what she thought had been the greatest improvement to treatment documentation. Her response was, "At Baptist, we have seen a lot of improvements in quality of care related to the nurses spending more time with the patients due to charting at the bedside. It helps save time and decreases errors. We have also seen that documenting while with the patient has improved the patient's satisfaction of care overall." So to implement our findings, we would present them to the hospital administration and see if they could provide computers in every patient room. We would train all staff to use the EHR system in a classroom setting, hire EHR training staff to temporarily circulate on the units, and provide information to patients about the new charting system. To monitor the effectiveness of these implementations, there should be an auditing of charts done on a regular basis to determine if charting meets Medicare standards. We should obtain patient feedback on discharge by providing a survey including questions about perception of the EHR to determine satisfaction with the quality of care, and corrective measures for staff found regularly not charting at the bedside to ensure that all staff is adhering to the new system of charting.